Good morning, everyone. I'm Lynn Haltain. I'm the Executive Director of the Victoria Law Foundation, and it is my great pleasure to welcome you to this VLF Research Network event on health justice partnerships, understanding their design, implementation, and value. I've just had a major technical fail here, so if I'm a little flustered, you'll understand why, but we'll get it back on track. We are so delighted this morning to have Suzie Forell, Lottie Turner, and Priscilla Ennals with us for this session, and I will introduce them to you in a moment. But first, the VLF office stands on the unceded Wurundjeri lands, and I respectfully acknowledge their traditional custodians, recognising their abiding connection to this land, its waterways and community. It's my privilege to pay respects to their elders and to all the generations who have nurtured this land for over 50,000 years and continue to do so. We believe that acknowledging the past is an essential step in building a better and more equitable future. We recognise the impact of colonisation, its legacy of injustice, and the marginalisation of Aboriginal and Torres Strait Islander peoples. We aim to break down the barriers to justice for all Victorians through our work in research, education, and grants. We are committed to making a sincere and positive contribution to a better justice system for all of us, especially those who are most in need. Just a few housekeeping points before we get this show on the road. We are in webinar format, as you would be aware, so only the panelists can be seen and heard throughout this presentation. But please use the chat function to introduce yourself to your colleagues and to make comments as we go. But if you want to put a question, then make sure you use the Q&A function, where you can also upvote other people's questions if you like the look of them, and we will get to those as many as we can through the event. We are recording today's session and we will distribute it via email afterwards. So if there are people that you know who would be interested to see this, make sure that you pass the link along, and also if you need to leave early for whatever reason, you can come back and see the rest later. So let's introduce you to our speakers today. Suzie Forell is a very dear friend of the Victoria Law Foundation. She's Research Director at Health Justice Australia, or HJA as it's known, which supports partnerships across sectors to address the complexities in people's lives that affect their health and well-being. Suzie's also taken this kind of partnership approach to the research work at HJA, collaborating across disciplines and sectors to explore health justice partnerships as a legal assistance strategy, as a health strategy, and in addressing intersecting issues that affect well-being. Suzie was previously Principal Researcher at the Law and Justice Foundation of New South Wales, where she led the What Works research program and managed research alliances with legal aid commissions to evaluate legal assistance strategies and to build evaluation capability. And with that team, Suzie evaluated a range of legal assistance strategies, including outreach, family law duty services, collaborative partnerships, community legal education, and summary crime services. She is also adjunct associate professor, my apologies, School of Law, Faculty of Law, UNSW, and honorary professor in the University College London, Faculty of Laws. Delighted to have Suzie with us, as well as Lottie Turner, who's Partnerships Director with HJA, and there she is responsible for leading the work in supporting effective practice across the health justice landscape, including convening, brokering, and mentoring health justice partnerships as they mature. A proud Kiwi, social worker, and accredited partnership broker, Lottie has spent more than a decade using the principles and tools of partnership in the promotion of health equity and social justice. She's led and supported complex organisational change initiatives, including the design and implementation of human rights strategies and frameworks in community health. She's a champion for LGBTIQ+ health equity and social justice, including through roles with Rainbow Health Australia and the Australian Research Centre in Sex, Health and Society. And she's advised on inclusion strategies and partnership brokerage for the Black Saturday bushfires recovery. And in 2015, Lottie was named by Junkie.com in their very first list of 200 young Australian change makers. And we are also joined this morning by Priscilla Ennals. Good morning, Priscilla, apologies. Priscilla is an occupational therapist and researcher who's worked in and around mental health service systems for more than 30 years. She's worked in clinical mental health as an occupational therapist and manager before teaching undergraduate and postgraduate OT programs at La Trobe University. She now works in the for-purpose sector for Neami National, a large national provider of mental health, housing and suicide prevention programs, where she's the Senior Manager of Research and Evaluation. Welcome, Priscilla. And the last person I need to introduce you to is our Research Director at the VLF, Professor Nigel Barmer, whom I won't go on about at length. You've heard this all before, but he will give you a short intro to the topic and then facilitate Q&A with our panelists this morning, and I think a full question and answer session as we proceed through the topic this morning. Nigel, over to you.
Thanks, Lynn. I'll just share my screen. Okay. So hopefully that you can see all of that. So I thought I'd just give a brief introduction before we hear from the real experts around why I've always thought health justice partnerships are a really good idea. And I'll be doing that by leaning on legal needs surveys, as I so often do. As many of you know, we currently have a legal needs survey in the field, our Public Understanding of Law survey. And it turns out I kind of like them, because what they let you do is see everything, not just the people who use lawyers and courts. It lets you see everyone, regardless of whether they do anything, regardless of whether they see their problem as legal at all. So it gives you a lot of information about how you might tailor, triage, prioritize, design services with needs and capability in mind. And they've taught us three broad things. They've taught us that not everyone is equally susceptible to legal problems or justiciable problems. They've taught us that not everyone is equally able to access legal services when they need them, or any services. And they've taught us that when people do access services, there's an inequality of benefits gained. So not everyone is able to extract the same benefit from the same service. They've also told us a whole lot about how health and legal problems interact, which I'll give you a couple of examples on related to these three broad lessons. So yeah, not everyone's got an equal chance of experiencing problems. These problems, they cluster, they spread, they make a right old mess, and they're linked to a load of things in your life. They're linked to disadvantage, to life cycle, economic activity, geography, and they are absolutely fundamentally linked to your health, and particularly your mental health. So over the years, we've seen health and mental health as a key predictor of problem prevalence, key predictor of multiple problems. Health has been shown to be a key cause and consequence of justiciable problems of a whole range of types. And this is fresh interim pulse data. So this is from right now in Victoria. And here we can see the percentage of people reporting one or more justiciable problem or legal problem based on K6. So this is a measure of psychological distress. So we can see none or low mental distress, pretty low problem prevalence. And as we see moderate or high mental distress based on this K6 measure, we can see problem prevalence increasing really dramatically. And it gets worse, right? So if we look at the people who just have problems, this is the percentage with big clusters of problems amongst those with problems. And once again, as mental distress increases from none to moderate to high, we're seeing the likelihood of big clusters of problems increasing pretty dramatically. So maybe we might think health justice partnerships are a pretty solid idea simply in responding to this massively increased problem prevalence. All right, second, inequality of access. Not everyone does or is able to do the same thing. People don't see the world through a legal lens. They can take some pretty ineffective paths to justice through no fault of their own. And here's a simple example from the Pulse data again. If we ask people how they characterize their justiciable problems, so these are things that, you know, me or you might see through a legal lens, but only a quarter of our respondents do. So there's only a quarter of the problems we identify where people are going, oh yeah, that's a legal thing. And this matters, right? So whether or not you see your problem as legal has a real bearing on whether you do anything, where you go for advice. And this is compounded by a justice system that's not easy to navigate. But maybe we might think the health system is a bit more familiar, a bit easier to navigate. And maybe we might think that health justice partnerships could ease navigation, remove some of these barriers to entry, for example, the need to characterize as legal. Then third, inequality of capability or benefits gained. Not everyone has the same needs, the same knowledge, the same capability. Not all services are appropriate for all users because needs vary, and new opportunities can bring new forms of marginalization. So again, turning to Pulse data, I can ask everyone who's got problems whether they needed more expert help. And this is a rough proxy for unmet legal need. And you get this, you get around a third of people at the time of interview saying, hey, I needed more help, more expert help for my problem. And once again, this is linked to mental health. So as we go up this K6 measure from non or low mental distress to moderate or high, so the percentage saying they needed more expert help increases. So once again, maybe we might think health justice partnerships could be a rational response to these increasingly complex needs. So it's kind of hard to argue against this sort of simple logic for health justice partnerships. And this is a couple of many research arguments make a case. And I looked back making the slides for this and just thinking, like, I've been a real stuck record on this. So I just pulled a couple of things I've said over the year. The first one's from 2004, saying, further integration would be a good idea. Third one's 2009 and 10, saying effective coordination could improve health and justice outcomes. Maybe integration and outreach are important, if we want to effectively support those with mental illness. So the question for today is, how do we move beyond this quite simple generic understanding of the intersection to, how do you actually do this stuff, and which version of this is best with scarce resources? So how do we understand the design, the implementation, the actual value of health justice partnerships? And fortunately, in this regard, we're joined by some real experts on this. Excuse me, I'll just get rid of that. So if I can now introduce Suzie, Priscilla, and Lottie to join us. And I'd just like to start by asking you, what brought each of you to health justice? And, what brought you to think of the value of legal services from a health perspective and vice versa? So essentially, I'm wondering what we're all doing in a room together here.
All right, I'll jump in first. Thanks, Nigel. It's really great to be here. Thank you. I guess what brought me to think about the value of legal services from a health point of view and vice versa was when I first started at HJA as research director and asking the questions, why do people partner? What do they look for in coming together? So what do legal, and I know from my point of view as an access to justice researcher, I was across, and part of that legal needs research. So I really understood why, from a legal assistance point of view, you would reach out, recognising that we knew that people, as you've just outlined, Nigel, who are experiencing disadvantage compounded by legal need, were not connecting with legal help at all or in a timely way. And also recognising that clustering of legal and non-legal issues. So really understanding that legal services will want to try appropriate care. But then the question is, well, why would health services seek to partner? What is it that legal help gives from a health service point of view? And, then you connect with the whole public health kind of literature and social determinants of health, and really begin to see that legal services could be a tool in addressing some of the challenges that the health services are facing. But I'm going to pass over to the other two. Priscilla, you can talk more about your point of view, and Lottie.
Sure. Yeah, thanks, Suzie. So I might just give a little bit of background about Neami so people understand what Neami is and where it fits into the mental health system. So Neami we're a large community provider, and we work in the mental health, housing and homelessness, and suicide prevention spaces. So we're in most states and territories. We're not in Tasmania or the ACT, but we're everywhere else. And our size, we've got around 1,200 staff at the moment, and last financial year we supported around 32,000 people across Australia. So we're not in the acute hospital settings, and we're not providing clinical community services as you might be more familiar with. So Neami sort of operates in the other spaces where psychosocial support, suicide prevention services. We provide some street outreach programs for people street sleeping, and wraparound support as those people might be moving into housing, those sorts of things. So we work with a real range of people. Some people, I think, I was talking to someone and they've had a 12-year relationship, ongoing relationship, supporting someone with enduring complex mental health needs, whereas many of our other services support people really briefly at a point of crisis, or at a point of where they're first contacting the mental health service system and wanting some navigation into other sorts of supports. Age range, we work right across the lifespan, but more typically we've worked with adults. What we've seen in the last few years is that there's more services required for younger people. So we're definitely working with younger teens and youth, as that's quite commonplace now too. So from a provider in that space, we, as you say, Nigel, it's not rocket science to know that there's a relationship between mental health and wellbeing and unmet legal need. And the sector has known that for a long time, but we were wanting to be more intentional about doing something about that. That the referral, efforts to refer people into legal supports or financial supports, they weren't necessarily effective. They weren't necessarily delivering to improve people's mental health and wellbeing. And I guess if we're saying that's our goal, that's what we want to do, well, how do we actually make that connection meaningful and actually deliver outcomes for people? So we really wanted to do something more. And like the way we came to be here was our CEO, Tom Dalton. He happens to be a lawyer and was hearing about some of the health justice work and put us in touch with Tessa Boyd-Kane, and the partnership with Lottie and Suzie has developed from there.
Thanks, Priscilla. And o tēnā koutou ko Lottie Turner o no rangiora o tēnā koutou katoa. I think I reflect on this, and I have spent much of my career in environments that look a lot more like Priscilla's than legal services. As a social worker in my former role with CoHealth, I was first introduced to the work of health justice partnerships, having the privilege of sharing an office with the HJP solicitor we had at that time from Justice Connect, who was helping us address challenges around elder abuse. But I guess I reflect back on, even my early career days as a social worker, a young social worker working in sexual and reproductive health, with lots of young people who I just think back now and think, wow, what difference would it have made to my practice as a social worker to have all the tools of legal assistance in my kit as well? What difference would having that relationship with a community lawyer have made to the kinds of outcomes that we were trying to achieve with the young folks who are accessing our services at the time? So that's what brings me into this work. It's probably been a decade in the making, but certainly someone who is really driven around the tool and the power and the potential of partnership to address some of the really thorny issues that HJPs across the country are hoping to achieve. So just delighted to be here in this conversation today.
Thanks. I'm kind of taken by Priscilla's idea of being more intentional and focusing on delivering outcomes. So, we've got this idea that coordination of these things is likely to or could improve health and justice outcomes. But, how do we do this? Is there an ideal model for these sorts of health justice partnerships? Are there better models? I'm assuming that's what you guys are all about. So can you tell us about the one ideal model?
Sorry, just jumping off mute. This is a tricky question, Nigel, and I think the short answer is absolutely not. I think when we think of the word ideal, we have to think of fit for purpose, and something that is really driven by the local context in which these partnerships are being established. I think the other two things I often think about when I think about ideal at a place-based level, I'm thinking about something that is good enough to help achieve the goals that are being determined in that local context. And I'm also thinking of something that in some way adds value to the aspirations of the services who are involved in that local context, adds value to the beneficiaries of the services, adds value to the practice of the practitioners working in that way. But really, that value will be determined at a local level. So it is really difficult when folks want a blueprint for how to establish these things, and they want something that they can replicate in lots of different areas. I guess what we're interested in is some of the key characteristics we see in health justice partnerships that report to us that they're working really effectively together towards their shared goals, identifying some of those characteristics and then helping to translate and interpret them in different contexts and settings. But my colleagues may have other views on that.
No, I think that's really beautifully expressed, Lottie. You know, for me, an ideal HJP is one that meets the shared needs, the needs of their clients, who are shared clients. And as you say, the practitioners and the services that come together to partner. And I guess it's sustainable within the context that it operates. And we know sustainability is a real challenge. And as you say, Lottie, you know, the needs and the service context vary, and therefore the partnerships are going to vary. And I think even in COVID, that's also challenged the way that we understand what partnering can look like. You know, I mean, one thing we've never, from our point of view, said co-location was essential, but it's often a feature of partnership. What does that look like when the world goes virtual? So I think, you know, as the partnering, the relationship is obviously really key. And as you say, there are elements of practice and ways of working together that seem to align with outcomes. I guess the other challenge is that there are a variety of outcomes and they look different depending on perspective. So the outcomes as a legal assistance strategy might look a bit different to the outcomes as a health strategy, and might look different again if you think about it as a strategy to respond to complex needs. And then there's, you know, as you said, what does it look like for clients? What does it look like for practitioners? And what's the systems change that has to happen around it to support it and enable it as well? So the effectiveness of health justice partnership is not just in the partnership, it's in the context that it works with as well. I don't know, Priscilla, if any of that resonates for you too?
Yeah, absolutely. And I think, you know, our partnership with health justice is multi-layered. So like we've got a national sort of partnership, like I have a partnership with Suzie and Lottie, and that's trying to think about, you know, what does Neami need and what could Neami benefit from at you know, large scale national picture. But then we've got these local partnerships building that are really focused in on a particular group of people who are seeking support at a particular time around a particular issue in a particular community, and they need a very specific partnership. So I think we've got the general and the specific. You know, there's all those layers. Just another point about when we think about outcomes, I guess Neami is really trying to centre the people who use our supports. What are the outcomes they actually need that's going to make a difference to their lives? So that we need to continuously pay attention to who, you know, what does success look like from the perspective of people using our supports.
If I just, so that was really interesting. Firstly, it gives you an idea of this idea of like characteristics, not blueprints, which I think is really important and something I'll probably circle back to. But for now, if we look to practicalities, we're talking about developing and tailoring partnerships to particular locations. So I'm wondering from sort of Susie's perspective, what's the practical role of research and data here? What data do you need? What do sort of legal needs assessments look like? What prompts them? What do you need to know? And also from kind of Lottie and Priscilla's perspectives, how do these partnerships develop then? Who drives them? Does it matter who's in the driving seat?
Oof, good questions. The role of research and data, I guess in the development of tailoring of partnership, I think one thing it really can help do is help clarify the nature of the issue that the partnership's aiming to address. So who are the clients at the centre? Who are the shared clients? What are their needs? And what are the needs of the practitioners that can help support those clients? And I guess the other value of research and data and gathering that information is to set a bit of a baseline against which the impact of the partnership can be assessed. So what does it look like now? And what do we think the partnership's going to do? And then we can see if, begin to see if there's a change from that. And that change might be in terms of the difference it's making for clients. It also may be the change in the capability of the service to respond well to that. So, and it's in that context that, so with Neami, they came to us and were interested in setting up 3 partnerships in 3 very separate locations. And our starting point, and again, this is also interesting just in the context of HJP in Australia, it has been very much a movement that's been led by legal assistance services, reaching out to health. So what we found really interesting was this was a health service saying to us, we're really interested, how do we connect with legal help? So we decided to take in each place, do a sort of a legal needs assessment and gap analysis in each location. So in a way, it was almost like taking the jurisdictional planning type methodology and bringing it down to the service level. So we used data. So we were interested in asking, who does each site serve? What types of legal issues are consumers experiencing in that site? And what are the strengths and relationships that the Neami staff and services have? And what else do they need to connect with the legal help that needs to be provided? So in a sense, that's the legal capability piece, but put in a less deficit language. I think that's been a real lesson for me. I think thinking about what are the existing strengths and challenges, knowing that that is part capability and also context. So so what we've done is use the legal needs assessment to identify, the reason for doing it was to help identify some potential legal partners for Neami in each of those sites, and also to get a sense of what are the types of activity that might be really effective in those sites. So if, for example, in discussion with the staff, we're hearing people don't have the confidence or they don't know who to connect with, that's some of the capability bits to deal with over and above the types of legal issues. So what else? Yeah, so we were able to look at things like de-identified aggregate data, so the reports of those services to get a sense of who are the client base in terms of age, gender, location, cultural background, the types of issues that are bringing them into contact with services, and connect that with what we already know from the legal needs evidence that clients of that particular type may be more vulnerable to. And then we took that information and tested it back with the workers on site. And importantly, Neami has both clinical services and peer support workers as well. So it was focus groups and discussions with all of those people to test that back. And so that we were just using that to, I guess, to identify, well, who are the local legal partners or other services that Neami could reach out to? And again, what's the type of activity? And that's where we took that over to Lottie. So I guess pass to you, Lottie, about what we did with that.
Thanks, Suzie. I think just to start off with, on that data point, the legal needs assessment as a document and a tool just made such a difference to my work in the work we've done with Neami, but I can only imagine the difference it would make to practitioners on the ground who are tasked with scoping and building health justice partnerships without a role like Health Justice Australia, they're backing them in on the ground, because it gave me something to use to work with Neami to make sense of what was written in that legal needs assessment, to really understand what might have been going on behind those words, and through those discussions really heard the critical importance of values alignment for those services. That wasn't something captured in the legal needs assessment, but the legal needs assessment enabled the conversation to get us there. I could then take that and scurry off and engage with the local legal services to chat with them about what they saw in that assessment, how it may have aligned with their priorities or not, the extent to which they had relationships with that local Neami service, whether or not they would be interested, whether they had the readiness or resources to scope a stronger working relationship. But I think it's really important to note there that at no point did we assume that partnership was going to be the thing. So what we were interested in is, well, what's going on here that might be shared across these services? And again, I go back to that good enough approach and that fit for purpose concept. Well, what might be good enough to get going, to start exploring what this working relationship might look like and offer these local services. So really, we brought everyone together and facilitated a series of discussions and workshops that were designed to really dig into that concept of shared values or values alignment, goals, and what a principled approach of working together might look like. And I guess that's really reinforced for me, you know, when we talk at length about the resourcing that's required to really scope and build a partnership approach, that it's not just about, to quote a Victorian practitioner, it's not just about inserting a lawyer and stirring in a health service. It takes really intentional, open, strategic work to build these relationships of trust that can enable a partnership to occur if that's the approach you want to take. I could talk at length about that stuff, but I'll pause because I'm kind of keen to hear what Priscilla feels that looked like from their perspective.
Yeah, and just to dig into it, you know, what are we talking about? The values alignment piece. Like this is it's a big deal for Neami, and it's a big deal because many of the people we're working with, you know, have had trust impacted by system interactions, you know, with a range of systems, health systems, legal systems, housing systems, all that sort of thing. And so if we're engaging in a trust relationship with those people, we need to know that when we're connecting them with legal, you know, supports or whatever supports, that we're doing that in a way that's going to be sustaining and generative for them, not that it's going to be, you know, impacting in a negative way on their mental health. So I guess we see that if we get the value stuff right, then we're much likely to generate a partnership that is effective, but is also can be sustained. Because I guess lots of efforts get made that aren't sustained. So I think, you know, if we're going to make an effort and build a connection with a service or a person, we actually have to think about, well, what's the longevity of that? And, you know, in health services at the moment, it's a really dynamic space. Services get funded, you know, sometimes on a 1 year to 3 year contract. There's a lot of movement in services and people and organisations in these spaces, and all of those things have an impact on partnership sustainability. So I think if we get the value stuff right, then we've got a solid foundation going forward. So I think that's why, you know, all that you know, effort, Lottie, and even the talking amongst ourselves between Lottie, Suzie and I and Sarah and other people at Neami has established a foundation that we're in a shared space. We're not coming in with a whole set of assumptions that we don't agree on, and that we've tested some of those things so that we're going forward in a sustainable way.
Nigel, can I jump in just because I didn't answer your question about the driving kind of mechanism of the partnership? So maybe just to speak to that very briefly, yes, it is really important to have some kind of mechanism that drives your partnership. I think that could be one service, but I think, and so, you know, looking at the history of health justice partnership in Australia, we know, as Suzie said earlier, that it has really been led by the legal assistance sector. So it may very well be the local CLC driving a partnership with their local community health provider. That will mean it's really important for that local CLC to think about the implications of that, to think about the extra work they may need to do to ensure that their approach is genuinely shared, that they are co-creating the solutions to the problems they see, that there's some sort of shared decision-making and accountability structure around that. Because I think for certainly in medicine, I think in law, we're talking about practitioners who understandably are very action-oriented in their practice. You spot a problem or issue, you address problem or issue. And I think it's important to sit back and think, okay, well, yes, that's really important in my day-to-day. What are the implications of that way of working when I'm seeking to work collaboratively with others? So my solution to this problem isn't necessarily going to be the same as my partner's. So I just need to bring that to the table and have an environment in which we can have a shared conversation about how we manage things and move forward together.
Sorry, can I just add one more thing, and going back to why the data at the centre, and also just to acknowledge that Neami, I've also been open to the fact that the resulting arrangement may not be a lawyer in the healthcare setting, that because we've started with the data, we've been able to really think, actually, you know, we thought, you know, we've come in thinking, oh yes, we're doing the groundwork for an HJP with the lawyer in the healthcare setting. But in fact, when you look at the data, something else arises. And when that data includes, pardon me, the need, but also the existing structures and what other services are around in the location. And so that was sort of, I think, you know, we were able to go back and say, actually, we're thinking here, having a lawyer in the setting is not the thing, but it's another type of relationship. And it might be more of an advocacy relationship. So I think it's just, again, having the data there enables you to respond to the data rather than thinking we're going in with a model that we're trying to implement. So it's problem and people focused.
Yeah, starting with curiosity rather than a solution. Yeah.
So I thought I'd just, I've seen a couple of questions pop up. I thought I'd just grab one from Liz Curran, who's joining us from Nottingham at what must be a fairly antisocial hour of the day. So hi, Liz. And she's just asking what the role of participatory co-designed research and evaluation is in how you design, what impact looks like from the outset. So do you ask community members in each context what it looks like? She's suggesting she finds this critical in her health justice partnership research to ensure it's connected, not based on assumption, with lived experience of clients. So she's interested in your views on that.
Yeah, hi Liz, and thanks for staying up so late to be with us today. It's really great to have you here. I mean, Liz has, you know, led a lot of this thinking for a long time, and really we value that absolutely. Including consumers and the users of services in the design of projects is really valuable. And certainly at Neami, you know, Neami has a very strong consumer voice and consumer focus, including in the workforce, so appears the workforce as well. So that's, you know, I think we're picking that up here as well. And I guess the other thing, and this is, I've been reflecting a bit more on this, when we talk about partners having shared goals, a health partner and a legal partner, the clients also need to be part of those shared goals. And I'll just give you an example of that. Speaking to an organisation that's got health justice partnerships in various mental health settings, and they were talking about, there was one partnership they set up where they did all the things, you know, really great communication between the health and legal partners, had a particular service setting. But the partnership just didn't get off the ground. Clients weren't interested. And it was the wrong place, because the partnership there aligned with the partnership goals, but it didn't align with the goals of the consumers in that location. In a different location where it was much more driven by, with a consumer sort of voice around the design of it and engagement, and aligned with the consumer goals in more of a, in a recovery space, they ended up with a much more effective partnership. So I think, yeah, really good points made.
And I think there are a few ways to tackle this one too. So I think it's really easy to jump straight to, let's have a community representative sitting with us on our steering committee or group to have that lived experience inform how we do what we do. Absolutely, that's a way. I think when you're in those early stages of scoping a partnership, and if you're a legal service going to a health service, talk to that health service about the different mechanisms they may already use to have that community voice represented in their work. You know, work that I've done in community health, there's been a big push towards things like goal-directed care planning, where there is a central feature in that work of really elevating the voice of consumers in the work of those services. I also think tapping into your state-based or local consumer representative groups or organisations is a great way to have that influence and perspective. There are lots of ways you can do it, and I think there's a bit of a stepping stone approach to how you can do that too. I'm really interested in continuing that conversation because I think it is the next big area we can focus our efforts on in health justice partnership, is really talking about what will this look like to partner with communities in a really meaningful way, and what do services and practitioners need in order to do that well.
And I think partnership does infer sort of an ongoing relationship. And you know, the partnership we're having with Health Justice Australia is about, well, where do we start? Let's start somewhere and test a few things out, and then we'll use whatever we learn from, you know, the 3 partnerships to draw up and say, well, what's the next step? And, you know, how might we further centre people who use our supports at the centre of a next phase of, you know, any research or partnership design.
So just before I kind of move ahead, I was just wanting to circle back briefly to this idea of legal needs assessments, because it's something that keeps bothering me. Like, they're kind of mysterious, right? And, you know, I know that it would be probably good to bring Hugh in at this point because he sees an awful lot of these things. But it seems like they all have quite diverse ideas as to what constitutes a good legal needs assessment. And I was wondering, from Hugh's point of view, you see an awful lot of them, and also from your point of view, you know, I like blueprints, it's probably becoming clear, right? But are there some common elements that we can think of as central to good legal needs assessment or good needs assessment? You're stumped.
No, I thought, Hugh, I think, was that directed at you, Hugh?
Oh no, I thought you were going to take it in the first instance.
Okay, well, I guess we were using this with a really specific purpose in mind. So the challenge we had was a service, you know, seeking to reach out to legal partners and to set up a partnership. So as we said, we were really thought, let's start with understanding what the nature of the issues are in that particular health service. And, you know, I think you and I have had these sort of conversations before about how you do planning, and in jurisdictional planning, you use geographic data in a lot of ways, but we know that within geography, there are sites where the profile looks different. And so I guess we were really curious to say, well, let's try and, you know, if we take that methodology and look at it in a particular location, how does it help us? So for us, it was a bit of a suck it and see. You know, there are different ways of doing this. I guess the essential elements for us were to understand the client group that is being supported in a particular place. Not to reinvent the wheel. There's already really great information. So we know, for example, in the services we looked at, everybody is there with a particular mental health issue because that's what brought them into the service. The one in particular was more further towards the acute end. but what else is happening? So we also knew in one of the other services, it was mainly people coming out of prison. So we knew, you know, from the No Home, No Justice report, a lot about what we might expect to see. But then we're able to test that back with the staff in terms of what they see, recognising that staff may, you know, we didn't say, oh, what are the legal issues your clients face? Because of course, the same issue that faces people faces staff. That is that when you say legal, people think crime, or they might think family, they don't think the whole range of issues. So when we do this work, we really go through all those areas of potential legal issues with people. And we can show you what that looks like on the survey we did right across all of the Neami services. But the other element, I think, is also looking at, well, it's not just about what the legal issues are and what legal service might do that particular legal issue for that particular type cohort, whether it's maybe women or men or Aboriginal or Torres Strait Islander peoples or young people or old people, whatever. But also what are the existing relationships within that service. So not assuming that we know that there is a high legal capability or low legal capability or existing relationships or not. So really to make sure that we start with where the service is at, including their existing relationships. And to listen to the staff about what are the things they're finding challenging. What do they say they need more support in? And again, we can show you what that looks like on the survey across the country. But yeah, I guess that's what I think both looking at need and looking at the context and the capability are some of the key features for the purpose of the assessment as we were using it.
Yeah, if I jump in here, yeah, I agree completely. I think what we've found from experience doing legal needs assessment in various places is that there is unlikely to be a single data source that is going to provide everything that you need, or everything that would be useful, everything that would be good to consider. And certainly in the case of co-design and thinking about responses for a particular place, getting a range of people around a table just to discuss what data says, what it's showing, what's going on. Often as researchers, we don't have the benefit of the on-the-ground experience to understand why data might be patterned in certain ways, what the barriers and the experiences of different people within various types of data might be. So it's, you know, it's the value of the discussing, the interrogating, the thinking about the data, and then thinking about how you might respond to that. So really, I think from my point of view, legal needs assessment activities are just a tool. You know, access to justice issues are really about problems, and they might be legal or related problems. It's about people and different types of people, and it's about places. So I am a person who would try to suck up as much different data as possible and try to bring that to the table. But equally, in a place where you don't have existing data, going through a data collection exercise can be really beneficial and provide some really useful insights.
Yeah. And Hugh, yeah, just picking up on absolutely range of data sources, but also that conversation. So, you know, when we looked at the original data, the first thing we did was go back to the staff and say, this is what we see. What do you see? How do you understand this? And with the survey data, which is the bigger survey, that's going to be part of our analysis process as well. Exactly that. So we come in at saying, oh, well, this is what we think it is, but what do Neami staff see reflecting back? What do the consumers see? So that's, yeah, we're actually integrating that into the analysis before we report this. So any of the data we're talking about today is not publicly reported yet because it's still in this sort of discussion phase.
And I think from a provider perspective, you know, staff on the ground can have a whole lot of knowledge, but if they don't have that the higher level data understanding, or if they haven't been able to look around at other legal needs assessments and things, so they can't pick out characteristics. They don't know what to do with their knowledge, so it actually doesn't help. And that's where these two sources of knowledge is coming together can make a real difference. You know, really engaging in deep sense making. That's where I think we'll get outcomes for people.
Okay, thanks. There's a question popped up that I really quite like, and apologies if I mispronounce your name. This is from Kaith Descala, and they say, would health justice partnerships benefit from integrating other services across different service areas with their practice as well? Which ones do you think would have the most impact or support the most change for clients? I'd be interested in knowing if this has been explored already. So this really goes to the, you know, what are we integrating here? So I'd be interested to hear your thoughts.
Yes, I think there's such an opportunity to explore multi-stakeholder partnership in the work of health justice partnerships. And it's certainly happening already in some scenarios and places. I go back to the fit for purpose aspect. So it's not always going to be about one legal service, one health service. I would assume that two services working together around some of the thorniest social issues we are presented with in society today is not going to shift the dial on some of those really thorny issues. It's going to take a collective approach across communities with diverse perspectives and contributions in shifting some of those issues. Let's look at, okay, we have issue A in front of us. Who are the stakeholders in our community who have a vested interest in addressing this problem? The school, the local primary health service, the CLC and Legal Aid Commission, who are they have a role in addressing that as well. Let's just map out all of those different stakeholders. Let's look at the extent to which we have existing relationships with those stakeholders and where we might be able to build new ones. Let's not turn our noses up at the tool of networking to build relationships and get us to the point where we have a foundation from which we can explore things like partnerships. So yes, I think multi-stakeholder partnership can play a real role, and I think we'll need to play a real role if we are to genuinely shift some of the challenges we have before us now.
And in terms of which ones are most important, that is completely context specific, I think. So it's really, again, it's not starting with an assumption that there's a range of critical connections needed. It's asking the question, you know, what are the connections that will make a difference in this particular group of people or in this particular community? And harnessing whatever strengths are there already, like, because I think that's, you know, sometimes we assume we're starting from zero, and actually we're often starting from a really good set of connections, but they could be bolstered by further exploration.
I agree with the other two, and also think about what in the enabling environment allows partnership. So some of the challenges are the fact that things like funding and purpose are very siloed, and that can get in the way of being able to bring all the various tools that are available to resolve an issue, wherever those tools sit. And that's for health justice or any type of services coming together. So.
And I think on that, Suzie, because we haven't necessarily been speaking to a fund or a policy audience, I think, in some of the examples we've been using necessarily. I think for those of you who are in roles like that, listening in today, Health Justice Australia is really interested in working with you to support you around, well, what does it take to really set services, your funding, up for success in the work of partnership. So if you're interested in having that conversation, we'd be really interested in talking to you.
So we've talked a little bit about being quite sort of specific to context, but I know that you guys have also been doing some broader sort of baseline research to inform the work you're doing. So when I have a look at my sort of, well, when Hugh and I look at our legal needs survey data, we get a pretty good idea of the types of justiciable problems that intersect with mental health issues. So I'm wondering, when you move to the broad service setting, what do you see? So I'm assuming in the first instance, you see some big clusters of problems. What else would surprise anyone in terms of the intersection between health and legal issues? You know, what legal or related problems are you seeing? And consequently, what might the response look like?
Thanks, Nigel. So I guess being familiar with your work and other, you know, the other access to justice work and legal needs work that has been done in Australia, in one way, when we looked, there's not massive surprises. Yes, we see a range of different legal issues. Bearing in mind that the work you're doing was really asking individual people, and here we were sort of getting a sense, more of a sense of what it's looking like in each of the services. So in each of the legal needs assessment, we saw some common issues and we saw some differences depending on the profile of the clients. But the other piece of work that we've sort of been referring to a bit was a survey that we wanted to do with Neami of all their frontline practitioners in all their services across the country. Primarily, we were doing that to explore the issue of this idea of legal capability, whether staff felt what they needed to respond to legal issues. But as part of that, we needed to ask, well, what are the types of legal issues they're seeing? So what we can do is just share with you. Let me just share my screen. Okay, just let me know if you're seeing that nice and clear. Yeah, so what we did a survey. There's about 1,100 or so frontline staff at Neami. Let me see if I can go back a slide. Yeah, so we had 13% response rate, so it's only 146 people. So again, this is not massive data, but it's really nice indicative data. So 146 staff from 70 services around the country, and there are the figures where they are. We had people in peer support roles, other support workers, clinical roles, and operations sort of team leader roles as well. And what we did was just ask them, we gave a list of legal problems. Again, not assuming that people have the same understanding when you say what is legal, with description. So we didn't just say money. We talked about debts and fines, payday loans, debt collectors, etc. And we asked how often do they see these issues arising with their consumers, and the response options were that they didn't see it at all, they saw it occasionally, sometimes, or frequently. So what you're seeing here is just those, the legal issues that people said they saw sometimes or more. So sort of with half of their clients of more. So you're seeing that money issues are a really common issue. Again, that's pretty in line with the legal needs kind of work. What interested us was social security and NDIA, so interactions with government were quite high. Housing and tenancy, family relationships. Interesting to us, if we just asked, do you see legal issues in your practice, and people had only thought about crime, then we would have missed all those other things. So I think what you're seeing here is, we're seeing a range of legal problems coming up in these services. In terms, I might stop there and then come back to the capability question. But Nigel, when you look at that, how do you feel that compares to what you would have expected?
I think the first thing that you notice, which I think whenever you move to a service setting is quite striking, whenever I've done things with young people in service settings, you see some of the same you see some of the same overlaps, but they're just far greater in magnitude.
Yeah.
So if we look at the percentages here, these are huge percentages. So you're looking at individual problems, but what that's pointing to me is you're seeing really, it's not just like, oh, they might have a range, there's the odd different type of problem. It's the overlap that's interesting here, right?
Exactly.
I mean, look at the percentages, they're just huge.
Yeah.
So I would expect to see the same picture with a legal needs survey, but we could bring the percentage right down.
Yeah. Yeah.
And I think from a service perspective, this shows the complexity of what a staff member is engaging with when they meet someone. So they're really there to meet someone around addressing their mental health needs, but there's all these other things in the background that if we can't get any traction on some of these issues, we're not going to get much traction on supporting mental health and wellbeing. So it just reinforces how important this integration is.
And for me, I think it reinforces, and again, this is just through Neami's data, it may be different in other contexts, but the real importance of a generalist toolkit in addressing some of these things. And with that, the relationships and connections to the expertise that might sit across those different areas of law. But I think in the first instance, what we were looking for is a service that could really help address a range of those issues.
Yeah. Exactly that, Lottie. I think, yeah, it's not a one-on-one partnership when you see the range of things that are going on here.
So we're kind of edging around it, but let's talk a little bit more about like moving from clients to employees of service. Susie's and Lottie and Priscilla have touched upon this, but talking about sort of needs and capabilities of staff, right? So what does staff need to know to make all this work? So to need partnerships work, I'm assuming you're probably going to need some understanding of legal issues among health professionals and health issues among legal professionals. So how do you achieve this? How do you test it? And is it just about knowledge?
Yeah, good question. I mean, I think part of the value of partnership is that you're bringing unique skills and knowledge together. So you obviously, that you're not trying to build a situation where the health staff know how to deal with legal issues and vice versa, but how do you bring those together? I guess our starting point for asking about what do staff need sits back in the work we were doing around legal capability at the Law and Justice Foundation with Hugh working on that. And that we know that people who need legal help don't necessarily have all that it takes to get that help. And that people, that legal capability includes that concept of skills, knowledge and mindset to be able to effectively address legal issues. And the starting point was not to assume that workers in services have higher legal capability or lower, like higher legal capability than the people that they support. So why do we assume that we're using people or trying to engage with people as a pathway to link legal services with clients? But if those on the pathway don't have the same knowledge, skills, etc., that they need, then that can be a bit of a blockage. So we're just curious to know, well, what does it look like now, particularly before we start partnerships? So I'll just go back to sharing again. Sorry about that. Get to the next slide. Eventually. Oops. Yeah. So I get what we did ask was we having presented all of the legal issues and asked people what they're seeing, we said to address the legal issues, to address consumer wellbeing, what do you need more of? And then gave a list of things. So we said, do you need no more of these things, a bit more, a lot more, or some more, or a lot more? So the data we've got here is a list of the things that we asked about, and those who said they needed a bit, some, or a lot more. And again, we can cut these data in other ways down the track, but just for now. And the thing that people said they needed the most of was connections. So they needed connections with professionals in other organisations. So 88% said they needed at least a bit more of those connections. Interesting connections with local communities. So again, back to Liz's point earlier, having connections with the community was as important as also having connections with professionals in other organisations in terms of what they felt they needed to best link clients to legal help. Knowledge of other services, so that we see knowledge there of other services that can assist, also knowledge about the types of legal issues that consumers can face, skills and experience. But we also see things like needing the processes, tools and resources. So there is the capability of individuals, so the knowledge, confidence and skills, but there's also the context. Do they have the time in their caseload to manage and respond to legal need? Do they feel they've got the remit within their role to respond to legal need? So it's just sort of thinking really broadly about what are the range of things that could potentially impact on people's ability to act as that conduit between legal help and their consumers, and also to give us a bit of a clue of how lawyers might be able to help. So is it that, say, with knowledge, when you're looking for knowledge about types of legal issues, that might speak to some some training or some secondary consultation. So I think by digging into what are the things that we think, what's the potential, what's the baseline at the moment, and then how might being in a partnership address some of these capabilities and contextual issues that could be currently a barrier to enabling partnership between health and legal services and sharing information. So I'll just leave that up if others want to comment.
Well, Nigel, I can't help but go back to the wee pie chart that you shared when you were setting the scene, and I think we'd be pretty naive not to assume that in that 3/4 population are non-legal folks, health practitioners. And so why I say that is because I don't think you need to have great knowledge and awareness of other disciplines in order to work in partnership, because I think partnership can enable the development of that knowledge and awareness. And I think really importantly, this isn't about making social workers experts in civil law. It's about them building enough information, them building enough resources to be able to know who they can turn to for help when they might need that help. And again, I think that's something partnership can enable, but doesn't need to be a precursor to partnership.
And to know that when they identify issues, they've got people that they connect with who they can trust to actually deliver, means that makes it safe enough to start to unpack some of these issues with the person who's presenting. Because I think that's a real issue for practitioners, is that if they don't feel like they can do anything, then they really don't even start to unpack it. They feel like they can't go there. And if they can't even go there in those initial discussions with someone to help sort through what are the actual issues, then there can be no traction gained on addressing any of those issues.
I thought I'd just very briefly look back to one of Susie's previous slides, because I've just seen a question pop up from Paul, who says, has the National Disability Insurance Scheme been considered as a barrier or solution to problems faced by HJPs? Now, I did see it pop up on one of Susie's previous slides. So do you have a brief comment?
Yeah, I guess since we did the legal needs, the law survey, NDIS didn't exist. So we were just really curious to see, does it pop up as an issue? We were hearing on the ground that NDIS was coming up more and more, and Priscilla might have more to say about that. But yeah, I think to begin with, we were just curious to see, what is it there? Is it something that people are dealing with? I think, the thinking of it as a solution, I think that's really interesting to think about. That's not something I've turn my head to at this point, but I think, yeah, it's a really great question.
Yeah, I mean, on the ground, you know, for people with enduring mental health issues, access to the NDIS is definitely an issue. It's been an enormous challenge for the whole mental health sector the last 4 or 5 years. But even once people get into the scheme, then sustaining supports in the longer term is also an issue, and actually getting the supports that will make a difference to their life. Like we know that many people have come against resistance to accessing particular kinds of supports. But I think in terms of whether it can be a solution, I guess the NDIS has to build skills in understanding the intersection between legal and mental health, or health issues generally and disability generally, so that they start to unpack that and include the relevance kind of supports into people's plans. And so there's probably a whole lot of work to do in that space to even start to unpack that intersection and therefore start to address it.
So as we all know, Hugh's all about evidence evaluation and what works. So I thought we might start to get to brass tacks, seeing as we're coming to the end of the session. I might hand over to Hugh to ask some questions around, well, scarce resources, why HJPs?
I'd put the question exactly like that.
Yeah, scarce resources, but also complex problems. So, I think, we've always argued that HJP is, it's a solution for addressing complex and intersecting need. It's not something you just do because you feel like it. We know that partnerships are hard, they're resource intensive, but we're also dealing with really complex, challenging issues, and those issues aren't going away. So I guess it's a practical response to that. Is it worth it? That is part of the evaluative question. Lottie, do you want to add to that?
Yeah, I mean, I think I'm probably at pains to stress partnership isn't always going to be the tool, and that's okay.
Exactly.
I think, there's work to be done to support services to identify when it is. And that's a larger conversation than we have time for today, but I'd certainly be interested in further conversations about that, and perhaps a deeper dive into some of the ways in which we can take account of a local context and need, and consider the various ways of working, the various participatory approaches that can help tackle some of the challenges that are emerging at a local level.
And I'd chip in, like, not from an evidence perspective, but from a real world practice perspective, is that we know the siloed efforts aren't working. So we have to try some other things, and yes, they have to be stringently evaluated. But yeah, siloed approaches for these really complex intersecting issues don't work. So we need to test these partnership approaches out.
If I jump in again, Nigel mentioned before we've been kind of stuck in a rut for a long time on some of these issues. Lottie spoke about the benefits of partnership and building understanding. I'm wondering, based on what we've heard today, we're talking to ourselves here a little bit. We have an audience. I think we basically agree with each other. Is the task of building what we think is a better way of working as a better way of meeting complex needs of various people across the community, really about that communication task at this point? Do we need to get better at communicating the nature of the problem, the nature of the siloed barriers? I could go into a structural analysis here that looks at how services are organised, how services are funded, differences between state and Commonwealth governments, we'd immediately get bogged down. So I'm really interested in how maybe we move that communication task, and particularly from my point of view, what the role of some evidence might be in changing the way that we operate.
Yeah, I think I mean, the thing I don't think any of us really want to come to terms with is that that's going to take time. Staying curious and opening lines of communication with folks we don't necessarily or ordinarily work with slows things down. It will take time, and a shifting of the deck chairs around current ways of working, as Priscilla spoke to, isn't going to make a dent in some of the challenges we have before us. So I think it will take a whole of system approach, and that includes policy, that includes funding, that includes services, that includes community, to really come together around this, to get real about, well, what is going to be required of us all, and thinking differently and acting differently in response to some of these challenges. And, you know, there's a huge amount of commentary around where we're at in the context of COVID-19 at the moment. We have a real opportunity before us to not snap back to business as usual or status quo approaches. And I think right now we are at real risk of doing just that. And so I think to take a pause and to really think about the consequences of snapping back to status quo ways of addressing problems in silos, and to really think about, okay, what is it going to take for me, for Lottie, in this context? What role do I have, and what do I have control over in the context of my work that would enable me to open up to new or different ways of working, and reach out for help, because organisations like HJA, VLF, we're here to offer that help, to support you in that work.
Thanks, Lottie. Yeah, I mean, I agree. I'd say, firstly, we're not the only ones asking these questions. So just as the legal assistance sector are looking at integration to resolve some of the challenges we're facing, so are health. And so part of the work we're doing is actually joining health studies that are exploring integrated services. And when these were studies that started thinking about what does integration look like within health, and we've managed to bring legal into that space to render visible legal help as a tool that may support complexity in the issues that they're dealing with. Where I'm going to is, I think, just as partnerships are collaboration, the research has to be a collaboration as well. The evidence isn't going to come from a single study. It's not going to come from a single set of partnerships or a single sector. And that we need to be realistic about what we expect the research to deliver. I think it will contribute to our understanding. A study is not going to say, for example, if you're trying to do a study to say HJP works or doesn't work, forget it. Like, there's too many understandings of what working means. Do we mean HJA to increase people's access to legal help? Are we thinking health justice partnership to address health outcomes, to address justice outcomes, to build the capability of services to respond to intersecting need, to support practitioners in their work so they can do it better, that they become less burnt out, etc. There's a whole range of questions to ask. I guess our feeling is, I mean, one thing we want to do is build a research collaboration to do a multi-site evaluation of health justice partnership with a number of partnerships in it. Again, but with the aim of, I guess, thinking about, well, what are some shared outcomes? We're not going to be able to look at every outcome, but let's choose a few really key outcomes that particularly funders and policymakers are particularly interested in, and explore those outcomes across a set of HJPs. And again, you need to do that because normally in research, you want to have an intervention that's consistent, and you can see you know, how the intervention affects outcomes. Partnerships are different. So I think if we have consistent outcomes in a study, then we can explore the various features of partnerships that seem to relate to those outcomes. So that's sort of one way forward that we're thinking of. where we've got partnerships who are interested in being part of this multi-site evaluation. We're looking for research partners and funding partners, recognising that it takes investment to do that type of research. You know, it's not something that we can just do on the cheap or hope that a single HJP can do, you know, within their existing budget, and recognising the support that the services need to be part of these studies as well. So there's a few thoughts.
If I'm just thinking of quality of evidence and we're thinking of multi-site evaluations, would you just be evaluating health justice partnerships there? Again,
what's health justice partnership? So, you know, I think, yes, our feeling is you need some, we're thinking of a set of health justice partnerships working in mental health, but it'd be interesting to have within that some health services without partnership. Because again, what does it look like if you're keeping the outcomes consistent? What does it look like when you partner compared to when you don't partner? But even when you say you partner, partnering is not always a single thing. So again, what are the features of partnership that may contribute to outcomes? So it could be really strong, solid relationships. It could be some of the activities that are going on. It could be that it works really well with certain groups of clients or in certain service settings with certain structures and not others. So, but to build that, I think you want a range of services. And I'm curious, like, I think it'd be interesting to have some non-partnership sites within a big study like that. Again, for that idea of the point of comparison. But I think, I'm always at pains to say that in a study like that, the aim would not be to compare partnership A with partnership B, but again, what makes, what are the features that seem to relate to outcomes?
Just before we wrap up, I thought I might try and squeeze in Michael Atkinson's question here, who's interested in Priscilla's point regarding the importance of trust to go deeper into an issue with a partner. And they were wondering whether there's a challenge and learning opportunity in terms of bridging differences in the way in health and legal staff see their world.
Definitely. I think that's a really important thing to think about, is we come from different worlds and we are going to foreground different issues. We're going to interpret things in different ways. And it's conversations between that I think will help us, get a bridge there. I don't think that's an easy thing though, because I think I think the worlds are very different or can be very different.
And I think that's one of the strengths of taking a partnership approach. We don't want to be working with people who are the same. There's no point. And so with that comes a certain amount of discomfort when people don't do things the way you do them, when people don't think the way you do, when they have different theoretical frameworks that underpin how they make decisions and behave. And that's the strength of partnership. And I think there's lots of great thought leadership around various strategies that can help build trust in lots of different contexts and settings. And I think a key one there is openness and communication. That's really critical in that work.
I know from, some of the Neami staff, engaging in these conversations has really widened perspectives of, what sort of legal issues do impact mental health and what might I do about that? I think that's, you get into the conversations and perspectives can change.
I think that's a lovely way to wrap up a great discussion. So before I invite Lynn back in, many thanks to Suzie, to Lottie, to Priscilla and to Hugh. And hi, Lynn.
Hello. Thought I'd pop back in right at the end. Nigel and Hugh, thank you so much for steering that conversation. I think there's no better way to explore these issues than through a sort of roundtable conversation as you've just had, which moves to the conceptual as well as to the deeply practical, which I think our audience would have appreciated enormously. So thank you so much to our panelists, to Suzie, Lottie and Priscilla. And please come again soon. These research network events are built to help you and your practice. And our aim is to bring you all sorts of diverse insights from international and domestic developments in the areas in which we're most interested in: access to justice and legal need. So please, if you've got ideas or programs that you're involved with or that you're aware of that we could showcase in our research network events, we would love to hear from you. So contact Alex Partington and let her know what you'd be interested in hearing more about. Thank you so much again for coming today. Don't forget that the video will be available through email distribution very shortly, so please feel free to spread it amongst your family and friends for their edification. And thanks again to all of our panelists today for a really fascinating insight, I think, into the cutting edge of how we make, I think, access to justice real for people at particularly challenging moments in their lives. And the mental health justice nexus, I think, is a really powerful case in point. We will see you again soon. Have a great day and go well.